Yeah, this is Collins. I'll be your host today. Today's session will focus on leveraging laboratory information management systems in the COVID-19 pandemic, a case study of Baobab LIMS. Covered in this session will be the utility of LIMS in strengthening lab systems, LIMS' role in research reproducibility and quality management, operational issues such as interoperability and integration with other systems and platforms. We are privileged to have presenters from the
privilégiés
South
d'avoir
African
des
National
présents.
Informatics Institute. Dr. Dominique Anderson will be presenting. She's a senior researcher and team lead for biocollection informatics from the MRC Bioinformatics unit of the University of the Western Cape. Welcome, Dominique. I think you can load your slides now and we start the presentation. For the audience, if you have any questions, please put them in the chat box and we will be able to answer them at the end of this presentation. Welcome, Dominique.
Thank you very much for the introduction. My name is Dominique Anderson and my co-presenter today is Professor Alan Christoffels, and we are both from the South African National Bioinformatics Institute. So biobanks are these specialized laboratories which collect, process and store biospecimens. These biospecimens can come from a wide variety of sources and can include human samples, environmental samples, plant or animal samples, and the associated data. Associated data is also referred to as the metadata. This data allows for linkage. For example, the collection of SARS-CoV-2 samples with adequate location and exposure event metadata can be used in surveillance and monitoring. Biobanks can be disease-orientated, population-based, or virtual. Virtual repositories are actually catalogs of biospecimens which are physically housed and maintained elsewhere. So I want to be able to provide some context here. So firstly, we need to collectively appreciate that biospecimens are an asset. And while I started this webinar defining biobanks, the reality is that any laboratory which collects a biospecimen, irrespective of location, size, or resource, is to some extent a biobank or a biological resource center. As a biological resource center, we have a mandate and a responsibility to look after these precious samples throughout the sample lifespan, be it 1 day, 6 months, or 20 years. The importance of standardized practices to care for and maintain this resource needs to be the primary mindset of anyone who is a custodian of a biospecimen. So in other words, you may think that you are not a biobank, but you are. So let's use this hypothetical example. I've been asked to locate the sample with the barcode 1568. I open the freezer door and this is what I see. So where do I start? Do I defrost the freezer first? So let's say I find the sample, but now I have to find the associated consent form. I know it's somewhere here, but I'm pretty sure many of us can relate to this kind of situation. So for the purpose of this talk, I really want to use the term biorepository. And the reason for this is that the principles of governance, quality assurance, ethical, legal, and social implications, and importantly, data management, are applicable to any laboratory who are custodians of biological samples. The core activities of a biobank or a resource center includes the collection, preservation, processing, and storage, and importantly, sharing of specimens. Biological resource centers are also important because they provide a controlled access to this valuable biological resource. They maintain quality samples which can be collected retrospectively or prospectively. These samples and the associated data are a driver for current and future research, both within public and private settings. Biorepositories can also promote biobanking science by conducting research for best practice development in this field. Biorepositories are a resource which provide a value for researchers, particularly those which do not have the capacity to collect and or maintain large biocollections. Globally, the appreciation of the scientific value of biospecimens for current and future research is increasingly being recognized. Biological resource facilities are very well established in higher income countries, but there is a concerted effort to establish these facilities in low and middle income settings. Irrespective of location, biorepositories are being recognized as biotrusts. But for a collection to be of value, particularly in the research field, samples in that collection must be of high quality. They must be easily tracked with sufficient lifecycle tracking and chain of custody. And they should have minimum associated data. Well-curated and annotated high-quality biospecimens are the cornerstone of biological science, and the value of quality biological specimens cannot be underestimated. Investing into the quality of a biocollection is important because they are indirect contributors to a bioeconomy. For those joining us on the webinar today who have been directly or indirectly involved in sample collection and preservation activities, you can appreciate that the amount of resources, be it financial, human resources, or time, that has been used to collect a single sample. So now imagine that you do not know where that sample was. Or imagine that that sample was of such low quality that after performing all the additional analysis at additional cost, there was no useful result. Taken together, samples and their quality have a massive impact on sustainability of laboratories in which biological resources are indeed a core operation. I personally feel that there is also a bigger picture here, and that means looking at the indirect impact on the public, be it in the form of a bioeconomy which could create jobs or the overall health of a population. I highlight the key requirements of biospecimens as being of high quality. Research relies on replication of results. Low quality samples can actually create a research replication crisis. A lack of reproducibility costs upwards of $28 billion per annum in the United States alone. For low resource settings, this is a financial burden which is crippling. But we also need to factor in the costs which we cannot calculate. This includes erosion of trust, a lack of collaboration and partnership, as well as the economic burden of disease. One of the #1 causes of a reproducibility crisis is ineffective quality management. And I'm sure that everyone is familiar with the phrase junk in is junk out. This is a basic principle that drives the need for quality management. And it is important to note that junk does not only creep in at the beginning of a research laboratory process, but it can be introduced at any operational level. It is therefore important to ensure quality management throughout the operational value chain. And while I can appreciate that error is sometimes unavoidable, there must be a concerted effort to mitigate the associated risks. The management of biological samples and the associated metadata in a biocollection can fall within two main pillars, the laboratory and the data. So while I will not focus on the laboratory, we must keep in mind that the data management is intertwined with the lab components. There are standards and best practice resources such as ISPIR and ISO, which can help guide biorepositories. So with this kind of management in place, let us return to our hypothetical example. Do you remember the sample 1568? And remember that we needed to also find the consent form. I'll give you a clue. There it is. So if we consider the time it took to find these now, doesn't it make sense to employ tools which do make our lives easier? Information technology resources such as laboratory information management systems are a key component of biorepositories. LIMS are an integral component to the informatics infrastructure that supports biobank activities. It forms a valuable part of the quality management roadmap. So to improve overall quality of samples, significant events related to the biospecimen lifecycle must be captured and recorded. This includes pre-analytical, analytical, and post-analytical laboratory operations. The resource not only tracks a biospecimen, but it should also manage data such as instrument calibrations, SOP documentation, and even inventory management. This protected database supports data collection and analysis while providing very strong privacy protection. They are an integral part of the quality management operations in modern laboratories and form part of these recommended best practices and ISO standards, which I mentioned previously. The implementation of a LIMS which supports multiple operations brings accuracy and flexibility to the standardized procedures and allows for better management of samples and associated data. And this ultimately increases quality. However, there are successful implementations of this resource. For the long-term sustainability with continual use, the system needs to be fit for purpose and future-proof. If a system has some shortcomings in this department, it needs to be used. Can it be sustained financially over the long term? Other considerations include the need for other services, training, and customizations. What kind of maintenance infrastructure is required? Does this lend itself for low resource settings which face the additional infrastructure challenges such as electricity supply or limited internet connectivity? What interoperability requirements exist? Does the system need to interface with other software tools? What are the country and institutional regulations with respect to installation as well as third-party software interoperability? Baobab LIMS is an open source LIMS. It was developed using the SOPs of a functional biocollection facility in Cape Town. It is robust, easy to use, and customizable. The system allows researchers to track the life cycle of a biospecimen in the laboratory from collection, receipt, storage, analysis, and reuse, all while ensuring that sufficient sample metadata is captured, in line with biospecimen quality management best practices. Baobab LIMS has also expanded its functionality to support laboratory operations with several enhancements and new developments. Baobab LIMS has 3 phases for implementation. The installation may be on a standalone server or in the cloud, depending on legislative or resource constraints. Data integrity is addressed by ensuring database replication and backup functionality. In terms of the setup, this considers the heterogeneity in laboratory configurations and operations. And while it is important to note that a lab might not have a current need for all functionalities, this may indeed change in the future. The operational functionalities include day-to-day items related to projects, biospecimen collection, and analysis management. So I would like to take this opportunity to refer to the Information System Evaluation Checklist by ESPA to demonstrate how Baobab, for the interest of time, I will only be focusing on a subset of these best practices. One of these best practices is in biospecimen management features. Okay? The system provides the ability to generate or assign a unique accession to each sample. In Baobab, all barcodes must be unique or else a system error occurs. Barcodes can be scanned using barcode scanners, and if a barcode is not provided, Baobab LIMS will assign a rudimentary one. Component with physical location. When you are collecting a biospecimen in Baobab LIMS, you must assign a storage location. And the storage location in this drop-down list that becomes available is dependent only on positions that are available. The system provides the ability to associate the sample and components to a participant. And this can be done in two ways. Baobab includes the sample donor using sample donor ontology, or it can be a coded ID for the subject. This coded ID does not need to be unique because of the fact that a single donor may in fact donate multiple samples. The system provides the ability to annotate samples with sample attributes. In this slide, you can actually see all of the attributes that are associated with Baobab LIMS. Just collecting a biospecimen. We have projects, sample types, storage locations, date and timestamps, volumes, units. The system provides the ability to configure storage in a hierarchy. A video, and I hope everybody can see this. It's very short. So in the system, we configure storage types. And once we have configured these storage types, we are able to assign storage. Storage is in a hierarchical level. And in this example, room 1 has a liquid nitrogen tank. The tank contains 3 racks. Within those racks, there are boxes. And those boxes have positions. Baobab will also create a graphic representation of your box and which samples are stored. The system provides the ability to track specimens with barcode ID printed on labels, and it provides the ability to query or search inventory of specimens and specimen components. Baobab LIMS contains a live search, and as you can see in this particular example, the code U10 brings up both the biospecimen information as well as project and other associated information. Baobab also allows for the printing of barcodes from the system using a standard barcode printer. The system maintains sample genealogy on aliquots, derivatives, and pooled samples. In this particular example, I refer to DNA-001. This sample has a parent called 1001 DNA. If I navigate to the parent sample and I navigate to the aliquot tab within this, you will see that DNA-0001 is indeed recorded as an aliquot of the parent. System provides logistic management and chain of custody tracking. Baobab does this in 2 ways, having a shipment module for empty consumables, which can be sent into the field for sample collection, as well as a separate shipment module, which speaks to shipping of samples. In terms of controlled vocabulary and data integration features, the system provides the ability to maintain controlled vocabularies or ontologies to enforce data standardization and control. The way Baobab has done this is that it has added MIABA standards for human samples, such as the sample donor and the disease ontology. And it has also incorporated the phage metadata standard for SARS-CoV-2. In terms of security, privacy, and auditing features, the system is capable of maintaining user profiles and credentials for different levels of access and functionality. In this way, when you create a user within Baobab, they are provided a unique username and a password, but they are also assigned to groups. The groups have different levels of access and privileges. The system provides an audit trail that minimally tracks certain fields. On this screen, you can see the audit log of Baobab, which tracks the audit date and time, as well as the user that was logged in when the change was made, the project, the change, the old value, as well as the new value. So an understanding of the challenges faced by bioresource centers and the LIMS functionality gaps promotes development of practical solutions to fit local need. The majority of features within Baobab LIMS meet the requirements for multiple end users, but there has been valuable enhancements which the development team have added in order to address end user challenges. Some of these challenges do still exist, especially with regards to, this is a particular issue when that third-party software is proprietary. Configurability ensures that the general functionality can be applied across a wide variety of laboratory setups, thereby addressing heterogeneity in laboratories. Baobab LIMS setup will include sample types with corresponding data, such as the retention period. Adding a minimum volume to a sample type allows for the flagging of samples of this type if an analysis, for example, has resulted in the minimum volume being reached. Instruments which are specifically found within the laboratory can be added to Baobab LIMS. Furthermore, the calibration and equipment maintenance within the system. The addition of suppliers, as well as the products and consumables which they supply, allows for inventory management in Baobab LIMS. And this is critical for shipping consumables for sample collection in the field. Minimum information about biobanking data sharing has been incorporated for human samples, and the phase of SARS-CoV-2 metadata standard has been incorporated for viral samples. This is critical, and the use of standardized terminology and in addition, a variety of applicable analysis can be configured in Baobab LIMS. Specifications related to analysis performed in laboratories allows for SOP protocols to be applied, and it is based on each laboratory's capabilities and even their instruments. For day-to-day sample management operations, clients are created. Projects are associated to the clients, and there can be several existing projects for a client. There is always a possibility of adding more in the future. Biospecimens are maintained for each project in this way, and only those associated with a project are shown in lists. Other operations such as kit assembly, shipments, biological sample collection, and even associated analysis are performed per project. In order to deal with high sample volumes, Baobab incorporates sample batching. Sample batching allows the user to create a specified number of samples prior to receiving the samples, and this can save time and data capture. There is also an Excel importer, which can be used for this. In addition, the value of the Excel importer is that if internet connectivity is lost, then a user can enter data into the sheet and import once connectivity is reestablished. I'm going to talk about the SARS-CoV-2 enhancements now. And SARS-CoV-2 enhancements actually separate the standard ontologies and minimum data requirements between samples collected for human research, which would use MIABIS, and those that are specifically collected for viral analysis. This metadata awareness contributes to interoperability and harmonization. The SARS-CoV-2 standard was developed by the PHASE Consortium, and Baobab LIMS has incorporated all the fields as indicated by the red squares. Configurable content type means that the metadata fields in this module can actually be applied to the collection of viral samples other than SARS-CoV-2. For this module, we include sequence library preparation fields. A library ID, which corresponds to the ID in a different system, actually allows for the linkage of sequence-specific quality metrics to sample quality metrics. Again, batching of high volumes of samples can be done with importing of an Excel sheet or via the batch module. New functionality that is going to be added soon is the standalone viral genome analysis tool. This allows for data capture related to extracting genomic material, aliquoting genomic material, quantifying genomic material using the fluorimeter and or the nanodrop, viral load determination via qPCR, and library preparation, combinations, depending on the user need. Interoperability with sequence quality management software is performed by library identifiers and the API capability to link sample data with sequence quality metrics. So the quality management of samples ultimately results in increased trust. Trust in processes, trust in results, and trust in the decision-making outcomes which are implemented as a result. Quality management done right results in increased opportunity in terms of funding, economic opportunity, capacity development, and collaboration. And importantly, quality management done right results in increased translational benefits. So in conclusion, LIMS systems such as Baobab have the capacity to track more than just the biospecimen lifecycle. Baobab LIMS manages laboratory operations through accounting functionality, audit logging, and even report analytics. It tracks the equipment maintenance, which is also a requirement for quality management. And currently, we are also in the process of adding storage temperature monitoring via a cost-friendly data logger and temperature probe system. We have a number of resources available for users, and we value user input and suggestions. In addition, we are scheduling a hands-on training session through the Africa CDC in April, and this will be open for anyone who is interested. Finally, the functionality of the LIMS is highly suited to current requirements, and new enhancements can be incorporated to meet evolving and emerging needs. So I would like to acknowledge the following teams and funders, and I would really like to thank the ASLM for providing us the opportunity to present this work. Thank you very much to the audience for your attention, and I would like to open the floor for questions.
Thank you, Dr. Anderson. That was very insightful presentation. I tried to answer some of the questions that you raised at the beginning. So how much time, effort, and cost does it take to collect a sample? I think those of us in this business know the struggle and the time we take to get these samples. And what would happen to a business whose sustainability relies on samples? And that's our business. It means we would not be in this business. So now we need to tackle the questions in the chat box. If you have any additional questions, please put them there. Thank you, Professor Alan, for answering some of the questions in the chat box. So the first question is from Samjay. He's asking, how are biosamples stored for future research? Anderson?
So I can answer this question for you. So there are actually a large number of best practices that will inform you how to actually store a very specific type of sample for future use. It totally depends on what your sample is as to what the best practices for that sample is. And this is why biorepository science is also very important, and why biobanking and biorepositories are so important, because they can actually contribute to developing these sort of standards and these sort of SOPs for the long-term storage of different types of biospecimens.
Thank you. Raymond, so Colson asks, how many developers do you have supporting the system?
So currently we have 2 developers supporting the system, and then there's myself as well.
Okay. Dr. Moyo asks, from your experience, can you share which type of labels have been the best for use in labeling biosamples for long-term storage without compromising the readability of the labels?
Okay, so there is actually quite a lot that has gone into finding out which labels are the best for this long-term preservation. There are a variety of options available, and one of the best ways to actually decide which is the best for you is actually to test these labels yourself. You do get, biobanks do have labels that are very useful and they are working very well for long-term storage.
Thank you. He's also having a follow-up question. Are you currently using liquid nitrogen-based biorepositories at the lab, or just minus 80-degree freezers for biobanking?
So we actually at SANBI, we don't actually have a laboratory, but we work very, very closely with those that do have laboratories and are performing these functionalities. The laboratory that the system was actually built from, the SOPs that it was built from, have both liquid nitrogen storage as well as minus 80 storage.
Thank you. Samje from Cameroon is asking, what basic laboratory requires a biobank? Is it only reference labs or BSL1 to BSL4?
Sorry, could you repeat the question for me?
Yeah, so it's basically just asking what kind of laboratory requires a biobank, or where can we bank biospecimen? Is it only for reference labs or the other labs from biosafety level 1 to level 4?
So every single lab that actually collects a biospecimen can be considered a biorepository. Because you are a customer for your research, you're most probably going to be obtaining those samples elsewhere. If you are collecting a biospecimen, you are in some way, shape, or form a biobank.
Thank you. Amha is asking, how do we encourage a standardized system of biorepository as a culture, at least in the National Public Health Institutes, as compared to the practice with research consortium?
So this is actually a very, very, very good question. And it is something that I feel that we need to actually instill a culture of quality management. And the way to do that is, personally, I think, is first to make people understand that if they have a biospecimen, they are a biorepository or a biological resource center. And this means that they really should be employing these quality management systems.
An ethical question. So from an ethical perspective, can any sample and data be stored in a lab, and for which duration?
So any sample can be stored in a lab, but there are obviously a number of items that you have to consider. The biggest items are things like, if you're collecting human biospecimens, there are a wide variety of ethical, legal, and social implications, and you have to meet those requirements. So for example, if you're collecting a human biospecimen, you should ideally have the consent, an informed consent of a participant to collect that sample. You can then store that sample if the participant has actually consented to the long-term storage of that sample. So there are a number of considerations depending on your sample. Other items that are starting to become quite relevant is the biodiversity principles. So in the Nagoya Protocol, for example, the Nagoya Protocol does not include human samples at this point in time, but it does speak to environmental samples. And the reason for this is to actually prevent exploitation of a certain resource from a certain country. So it provides you're then able to identify which people should benefit and have benefit sharing when you're obtaining that resource.
Okay, just a follow-up on the same. So is this the same under outbreak conditions, like right now?
Okay, so under outbreak conditions, you know, there is a lot of talk about the fact that this is a public health emergency. So I think that some of the restrictions are indeed relaxed, but we need to keep in mind that if we are keeping these samples for an extended period of time, and for future research, we need to be cognizant of making sure that we are doing these things in an ethical manner.
Thank you. Another question from Dr. Moyo. So he's asking for clarification on whether the Baobab LIMS can catalog the original sample and the aliquots from the original sample. If yes, does that mean you can have the original sample, say plasma sample, stored and the associated elution from original, say from RNA, DNA extraction, all linked in the system?
Yes, it is all linked in the system. So in other words, the system actually tracks any derivatives that are produced. So for example, a parent sample, and that parent sample is whole blood. And what you're going to do is you're going to extract DNA out of that whole blood. So what you're able to actually do is you'll be able to say that these are the metadata associated with that parent sample. And then when you create the aliquot sample, you specify that the parent sample exists. And then you can also specify different data associated with that aliquot sample, that derivative sample. So everything is linked, yes.
Thank you. Coulson Gathi asks, how long has this system been in use and how many labs and where are using this system? So the footprint for this system.
Okay, so the footprints of the system, so the system was started development in 2016. It has been going strong since then, and we have a number of people that are using it. So we have people in South Africa that are using it, some labs in South Africa. We have the Ivory Coast, we have projects with Nigeria, and we also have we had a project with the MRC in Gambia, Kenya, and Mozambique.
Thank you. Raymond Kennedy is asking, do private laboratories typically use open source LIMS software?
So that is a very good question. So private laboratories that are generally very well resourced tend to use commercial systems. That by no means says that those systems are absolutely wonderful in their functionality. And I know personally of people who have commercial systems in place, but they are still having problems in terms of systems. But there is going for more open source systems simply because of the fact that the long-term sustainability, especially on a financial level, is becoming quite strained, especially with the fact that that funding is becoming quite restrained.
Thank you. Pilot Masunga is asking, is after sales maintenance of LIMS provided, and is there a possibility of training local technicians to maintain the system?
Yes, of course. So the thing about Baobab LIMS and the way we see it is we have this principle of training the trainer. So what we would like to do is train you, and then you become the trainer for future training events. So we also do have support technical support. And we have a help desk. We try and really sort of make sure that our clients interfacing and our client services are very high, because it is an open source system. So we do have the probability of training, and you can maintain the system yourself with the right resources. I think it's important to actually note here that even though a system is open source and free of licensing, there is a cost of ownership. And that cost of ownership is generally in terms of your infrastructure and in terms of having people to maintain the system. It's important that you have this in place, irrespective of whether you're using a commercial system or whether you're using an open source system. But because of the fact that once that system is installed in your laboratory, you are the owner.
Thank you. Colsot is following up and is asking, does the system already integrate with the laboratory equipment?
Okay. So this is a very big challenge. So there are some passes that have been written for Baobab LIMS for some instruments, but this becomes a very big, who is using which pieces of equipment. It also becomes a challenge because of the fact that some labs are using very old instruments which don't have that kind of interfacing ability, and some labs have very new instruments. But the big issue is obviously got to do with heterogeneity. So having to incorporate one instrument at a time for all different labs does become a bit of a challenge, but it is something that we are happy to address.
Thank you. Muuko Matobo is asking, can the information of the samples be captured remotely and be uploaded later to central biobanking?
Okay, so it depends on whether whether you have internet access, because Baobab is accessed via a web interface. And what we've done there is that we've actually tried to ensure that the Excel spreadsheet would be the best way to do it currently. But there are other projects ongoing about field-based sample and data capture that can then be uploaded into the system later.
Okay, I think the follow-up question from Teferi Mekonin is on the same line. So is the Baobab LIMS a web-based system, or can it work offline?
It is a web-based system. So unfortunately, yeah, the connectivity is an issue, but we have obviously tried to address this connectivity in a way that you can still collect samples, you can still enter sample data into your Excel sheets and import that. One of the things that we are also looking to integrate is one of the sample collection or one of the sample collection programs that are widely used, and that's REDCap.
Okay. Coulson is asking, what language is used to develop this system?
Sorry, can you repeat that, please?
What language is used to develop this system? Maybe he can raise his hand and we let him ask, because it's not clear whether it means the software language, if this is available in other languages.
This is Alan. I think I replied to that.
Okay.
Dominique. So it is based on Plone, and then we also use Python.
Okay, fine. Walter Olo is thanking you for a good presentation, and he mentions that the system seems to enhance sample security and reduce bioterrorism. Do you agree with that?
Yes, so the big thing about having this sample ownership and having this sample quality and being able to track exactly where your samples are is so important in terms of biosecurity. And we need to appreciate that. We need to understand that knowing where your things are stops people from just walking. We talk about samples being stored under barcodes and that sort of stuff, and personal identifiers being removed if they're human samples, for example. But knowing where things are means that, like, if anything happens, you're able to actually have quick decision-making processes. So it's not a question of, oh, the sample is not here, stress, panic, something's happened. It's more a question of the sample is not here because I don't know where it is if I don't have a system like this in place. I hope that answers your question.
Thank you. Coulson is having a question on the advantages of using Baobab over other open source softwares.
So there are a number of open source software that are available. I think it's not a question of there being a specific advantage of one over the other. The importance, I think, comes from the fact that you evaluate these systems to make sure that they are fit for your purpose. One of the best things about Baobab is that it was built using the SOPs of a functional biobank. So it has those quality assurance metrics in place. But on top of that, what we've done is we've really spent a lot of time talking to users, talking to end users on the ground in labs to be able to understand what they want the system to do on a laboratory level. It's perfectly fine for us to build something out of the box and just assume that this is what users would want. But I think the important part is to actually understand what users are doing on the ground, and where their challenges are.
Thank you. Raymond Kennedy is asking if you have any evidence that shows improvement in laboratory productivity efficiency that can come from installing LIMS in a typical African laboratory.
So there are actually several papers that talk about how laboratory efficiency has actually been increased after implementing a LIMS system. There is even a very good paper which talks to, and I'm not just talking about Africa, I'm talking about low and resource income settings. But this is one that was in Vietnam. And in Vietnam, they saw a massive increase in laboratory efficiency, in how they managed patients, in return of results, saving of time, saving of resources. It was absolutely very inspiring to sort of see that a system like this can actually contribute so greatly. But the important aspect of this being successful is that everyone buys into it.
Thank you. Rufus Nyaga is asking, how configurable is Baobab LIMS as trained super users? Are administrators able to make changes on the workflow?
So it is very configurable. Administrators are generally responsible, super users are generally responsible for most of the configuration. On a level down is a lab manager, and a lab manager is only able to make certain edits. But it's the super user that has the biggest amount of control over this.
Final question on the chat on if you can elaborate further on integration with other systems that are already in place. So does the system have an API that is functional for integration with other systems? It
does have an API, and it is in fact this API that we are currently using to integrate the temperature monitoring probe and data. So it does have a functioning API. Obviously, the caveat to that is that anything that you want to integrate needs to also have an API.
Okay. Yeah, so there's a question and you can raise your hand and we'll give you a chance. Otherwise, I'd like to give Professor Alan to make some comments before we end.
Hi, yes,
Professor
thanks. And I actually just want to say thank Dominique for doing the presentation. Looking at the range of questions that were asked, I think we clearly share the same sentiment that we probably need a shift on the African continent to ensure that we properly archive a very rich heritage of biospecimens. And I think we've certainly encountered not just just in Africa, but globally, I think that there are many laboratories that are grappling with funding models that are not quite sustainable. And so finding a solution where labs can in fact own the product. And so I saw a few questions around how do people contribute code. I think that is exactly the kind of community of practice which we are trying to grow. And then you've heard about 2 or 3 technical folks that are supporting this project. I think it's important to realize that we have collaborating partners, and the more we see this as something that can be owned by researchers, can be owned by lab personnel, we can collectively contribute to a core set of code that can actually add value. And so I think I'm quite excited about where this is heading. And some people rightfully pointed out that there are a number of software out there. I would just probably encourage people to have a look and just ensure that the software that you ultimately decide to use has sufficient support, that you can have ready access to personnel, and then have a funding model that actually works for you. I think it's key for us. I think as we grow our expertise, both in terms of scientific expertise as well as a research interest space in order to do that. I will stop there. Thank you.
Thank you, Alan, for those comments. Alison Taylor is asking if you can share the paper that you mentioned with the success of the LIMS in Vietnam.
Yes, and I'm also happy to share the paper that talks about the success of LIMS in Zimbabwe. I'm happy to share those papers. If she could pop me an email, then I can send that information to her.
Okay. I see one hand. Kilo.
Yeah.
Go ahead and ask your question.
Okay. Good afternoon, everyone. Yeah, and it's a very good one that Dominic did a very good presentation on the papers, and it's so enlightening and very encouraging for young laboratorians, let me put it that way, and especially people with the interest in virology and molecular science, basically. So, which is a new definition in the world of healthcare and science phase in this country called Nigeria. I'm actually talking from Nigeria. So, as it may be, I would like to applaud that. I would like to applaud, if possible, this training paper could be shared, well digested. So if further questions can be made available, further questioning could be achieved if a direct contact with Dominique can be established, and people of interest in the biomolecular phases and biosafety process could maintain a link for proper research assistance. Research technology could be activated. So I would rather say that I enjoyed the training, and I would still like to have a connection later in the class. Thank you.
Thank you, Oladayo. Dominic?
Thank you very much. Yes, I think that it is so important if we want to actually create a standardization and a harmonization, especially in e-resources, as well as laboratory management, intertwined. And I think it's so important that we maintain contact and we maintain this sort of open communication. I have added our help desk email to the chat. Anybody, please, if you have any questions, please just send me send an email to that particular email address. And I've also added my personal email address, is available to assist
Dominic.
people.
Yeah, just a reminder that a training will be provided, a more in-depth training. So watch out for the announcement. So at this stage, Dominic, you can give your last comments. before we leave?
So I really appreciate the opportunity to be able to talk about this. And I hope that I have managed not just the IT system in quality management, but also everything that revolves around it. I hope I've also managed to convince everyone that irrespective of whether you consider yourself a biobank, if you're a custodian of a sample, you are in some way, shape, or form mandated and responsible for looking after that sample. These samples are so important, and I really think that we need to really prioritize how important these items are.
Thank you, Dominique. Yeah, so just to end with the junk in, junk out. So we need to consider biobanking to ensure that the samples that we spend so much time and so much effort to collect leads to some meaningful result, either for patient management or for public health. Otherwise, thank you for attending this session, and may you have a good evening, good morning, and good afternoon. Thank you.